Hello, I'm Nienke Wessels, GP in training and PhD candidate, and I'd like to present our abstract titled Caregivers' Attitudes Towards App-Based Treatment for Urinary Incontinence in Women. I have nothing to disclose. App-based treatment for urinary incontinence can increase adherence and may lower barriers for women who seek treatment. Recent studies show that apps could be an effective and cost-effective option in the treatment of urinary incontinence. Knowledge about the attitudes of stakeholders is important for successful implementation, but lacking. Therefore, our aim is twofold. First, we aim to explore the perspectives of care providers towards the use of an app in the treatment of urinary incontinence. And second, we aim to identify anticipated barriers and facilitators for implementation of such an app, according to care providers. We performed a sequential mixed method study consisting of focus groups followed by a quantitative survey. We organized 5 focus group sessions with main caregiver groups involved in urinary incontinence care: general practice assistants, general practitioners, pelvic physical therapists, and uro and gynecologists. Emerging themes were used to form a quantitative survey, which was widely spread among Dutch caregivers, to further investigate their perspective towards the possible role of an app in urinary incontinence treatment. 741 caregivers completed the survey. Qualitative analysis of the focus groups generated 36 codes, which were merged to 10 categories collated under 3 main themes. These were app in the context of current care, suggestions for app content, and facilitators and barriers for implementation. During the focus groups, most caregivers stated that they saw clear advantages in using an app for urinary incontinence treatment. They felt that it could be an easily accessible way to provide care for a large group of women. However, a few care providers stated that some women would not be able to perform the exercises correctly in the absence of a care provider. On a 5-point Likert scale, care providers agreed that an app for urinary incontinence can support regular treatment, that it should always be used under supervision of a care provider, and that it can be a sound alternative for women who don't visit a care provider. During the focus groups, caregivers also discussed which app features they would want to see in an app. They rated all suggested app features as useful to a great extent for patients as well as for care providers. For example, monitoring severity of complaints, treatment adherence, and the level of patient satisfaction. Additionally, during focus group sessions, caregivers discussed what they would perceive as a barrier or facilitator for implementation. Survey participants agreed that an app should fulfill legal obligations regarding safety and privacy, and that the effectiveness should be proven before they referred patients to such an app. Care providers were neutral regarding a lack of time as a barrier for implementation, as well as a lack of financial compensation for this time investment. Despite the evidence for effectiveness of eHealth for urinary incontinence as a standalone treatment, care providers seem to have different opinions about app usage in absence of a care provider. Surprisingly, and in contrast with the results from other studies, a lack of time or financial compensation were not perceived as important barriers for implementation in our study. We conclude that care providers see a supportive role for an app during and after regular treatment. This study provides valuable insights into several contextual factors valued by professionals regarding implementation of an app in the treatment of urinary incontinence in women. These factors will be taken into account to promote future implementation. Thank you for your attention. If you have any questions or comments, please feel free to respond by email or by using the forum below.